Demand for the coronavirus vaccine is high across the country, especially for seniors. People in St. Johns County, Florida, started lining up for shots early Saturday morning, but only 600 people got the vaccine. Officials had to turn everyone else away. I'd like now to bring in Mark Parkinson to talk about the coronavirus vaccine. He is the former governor of Kansas and president and CEO of the American Healthcare Association and National Center for Assisted Living. Mark, thank you for joining us. Seniors are obviously one of the groups most at risk from COVID-19, but there have been delays distributing the vaccine to seniors. What are the challenges getting that particular demographic vaccinated?
Well, it's the same challenge that we see across the country with the general population, and that's the fact that we have a vaccine that requires 2 doses and has to be stored at extremely cold temperatures, which just adds a layer of complexity onto what is already a very difficult situation. The good news is that we are starting to see clinics actually occurring in long-term care facilities. Most of the long-term care facilities have been scheduled for their first dose in January. So we do have the ability to very quickly turn this around if we can just get our act together and get these vaccines out.
Well, as I mentioned, in some states, seniors are actually camping out to get the vaccine. And in some cases, like that one I just mentioned in Florida, they're being turned away. So what is your message to those who are still waiting to get vaccinated? And what do you think when you see those types of images?
Well, there's a grim statistic that less than 1% of the country lives in long-term care facilities, but 40% of the deaths from COVID have occurred in those facilities. And as grim as that statistic is, it's actually an opportunity because it means that if we can get that 1% vaccinated, which is about 3 million people, we can cut the death rate overnight by 40%. Then we really have to focus on older people in the general communities, particularly those that have underlying health conditions. And so it's really incumbent now on every governor to sit down. I know it's a holiday weekend. They need to be working this weekend to figure out what is our plan for getting all the folks in these facilities vaccinated and then making sure that everybody else that's over 65, 70 or 75 is vaccinated immediately. There is no excuse for delay. This is something that governors are capable of solving, and we really challenge every single one of them to do it.
So I hear your challenge, and the statistic that you just brought up was one that I was going to share with our viewers because it really is tragic, the death rate in long-term care facilities. So let's talk about that challenge that you just issued and how we get that vaccine to residents in nursing homes and assisted living facilities. Is there a more efficient way to be vaccinating this population that isn't taking place right now?
There is, and it's really all about leadership. So, for example, if you look at West Virginia with Governor Justice, every single facility has already had their first vaccination clinic. If you look at Connecticut with Governor Lamont, every facility has either had their first clinic or will have it within the next 2 or 3 weeks. So what it's really all about is the governor looking at the specific situation of the state. And if you're in a rural state, probably not using CVS or Walgreens, but using a long-term care pharmacy. If you're in a state that's highly urban, like Connecticut, really focusing on Walgreens and CVS. But what this really comes down to is it is a leadership test for governors with life and death on the line. And each of them is capable of solving this problem and of saving these lives. The solution is individual in each state, but it's solvable in each state.
So let's shift away from leadership to talk about the real humanity of it. What do you tell people who are concerned, given these statistics, about their loved ones who are in assisted living facilities right now?
Well, they have a right to be concerned. What we have shown across the globe over the last 10 months is that this virus is virtually unstoppable. And for people that are living in congregate settings, it's really, really tough. The consolation that I would give them is that we do now, for the most part, have the equipment and the testing that we need to slow this down, but nothing's going to slow it down as long as the public is still acting irresponsibly. And, the video that you showed of people being defiant over New Year's is just ridiculous. It's maddening. What they're doing is they are inadvertently killing older people in congregate settings because of their irresponsibility. But I would say to folks who have loved ones in buildings, help is on the way. We will not stop until everybody gets their second dose of vaccine. We are optimistic that will be completed by the end of February. so that really starting around March 1, we can have this nightmare behind us.
Well, one last question for you, Mark. As I mentioned in the introduction, you wear two hats, and one is as the former governor of Kansas. How do you think your state has been doing, and what would you be doing differently if you were still in office?
Well, as I said before, each state's situation is individual. Kansas is a rural state with a couple of major metropolitan areas. So I think that what Governor Kelly is doing there is fine, and that is using CVS and Walgreens when you're dealing with an urban area, but then being flexible enough so that in rural areas, harder to reach areas, they are using the local pharmacies. But in general, I think Laura Kelly's done a terrific job with the pandemic. Most governors have, but now is the time for them to really put the accelerator on and get this last problem solved of getting everybody vaccinated.
All right. Lots of good wishes for 2021. Mark Parkinson, thank you.
Thank you.